Hello, I am Jasmine Medal Sadanyo from BSN 111B Group 6, and right now I am going to perform the open gloving return demonstration. So before proceeding to the procedure, review the client's record and orders to determine exactly what procedures will be performed that require stellar gloving. So there are 4 safety considerations that we must remember before performing open gloving. So first is to choose the right size of the gloves because gloves come in multiple sizes, so you have to make sure that the gloves are fit enough to your hand so that it will be easier for you to pick things up. Second is sterile gloving does not replace hand washing. Hand washing is a must before and after any procedure. Third is to gather all supplies and prepare your patient for the procedure before applying the gloves. And lastly, ensure your patient is not allergic to latex, and if he or she is allergic, then you can use a non-latex gloves. So prior to the conduct of the procedure, I have already performed a thorough hand washing, and as what I have said earlier, hand washing is a must before and after any procedure. So here I have prepared my sterile gloves. Ensure the sterility of the package of the gloves. Check if there are any tears or stains, and make sure that your gloves is in the right size. So as you can see here, the packaging of my gloves is still clean and no tears or any stains. And I choose the size 7, which I believe belong to the small category. So we may now proceed to the procedure. I am now going to remove the outer wrapper of the package. So tear it carefully and make sure to not spill the inside package. Careful not to spill the inside package to keep the sterility of the gloves. Now grasp the inside package and place it on the clean, dry surface. Because any moisture can contaminate the gloves, so open the inner package and identify your dominant and non-dominant hands. So since I am right-handed, then my dominant hand is my right hand, and the non-dominant hand will be my left hand. So we must glove first the dominant hand for easier application. Now always remember, the hands are not sterile, so by touching only the inside of the package, inside of the glove avoids contamination. Now, to do this, open the package, grasp the glove of the dominant hand by its folded cuff edge with the thumb and the first finger of the non-dominant hand. So remember to touch only the inside of the cuff, and slide your dominant hand careful. Okay, so do not adjust yet. We can adjust it later. Now for the non-dominant hand, pick up the other glove with the sterile glove in hand. So insert the glove finger under the cuff, folding the glove thumb close to the glove palm, just like this, and pull. Okay, and just like the non-dominant hand, tuck in the thumb and insert your fingers. Okay, so now that both my hands are now gloved, we can now adjust for the perfect speed. Now once the gloves are on, interlock the gloved hands and keep a distance away from the uniform, keeping hands above the waist and waist level and below the shoulders to prevent accidental touching of non-sterile gloves, non-sterile objects, or anything that can cause contamination. So, in removing the gloves, first we must remove the dominant glove. So grasp the outside of the cuffs and gently pull the glove off, turning it inside out and like that, and place it on the gloved hand. Now take the ungloved hand and slide fingers inside the remaining glove. And pull the glove off by turning it inside out over the hand. And then discard the used glove inside the stopper in appropriate container. And lastly, perform hand washing and document the sterile technique that was used in the performance of the procedure.